One of the reasons why we made the Max was to allow for anti-claw splint, which is traditionally a little bit more difficult splint to make for the therapist. It's a little bit futzy in getting it to fit right, and we feel that this has really simplified the process. And so what you would do with the Max to put on an anti-claw splint, which you use for a ulnar neuropathy or an ulnar nerve laceration as part of their rehab to prevent the hand from becoming contracted in addition to having the nerve problem. So you use the anti-claw splint as a functional splint so that the patient does not hyperextend on the ulnar side. So what we're essentially trying to do is keep the metacarpal phalangeal joints in a relatively flexed posture so that now the PIP joints can extend and the hand would be more functional that way. If you have a dense ulnar neuropathy or ulnar nerve laceration, you will get this clawing posture where you get hyperextension at the MCP joint, and you won't be able to fully extend at the PIP joints, and you essentially start losing function very quickly on the ulnar side of the hand. And so here's how you would configure the splint for a standard anti-claw for the ring and small finger. So having the hand in the position that you essentially want it to be in, which is, this is basically a blocking splint, blocking the ring and small finger MCP joints into a little bit of flexion, 20 to 30 degrees. So you first take 2/3, 1/3, and I'll wrap it around and just crisscross it on the palmar side of the hand. And you just get a comfortable fit that way. This is a smooth silicone band, very comfortable on the patient's hand. And then you simply wrap back around on the back side of the hand to find the appropriate sizing for that. And that will squeeze down, not too tight of course, but it comes inside those metacarpal phalangeal joints where there's a little sulcus, and that holds the splint in place, keeping it in relative flexion. And then you would lock your tabs as we have shown in previous videos. So once the tabs are all locked, this is basically what you have and what it looks like, and it is the type of splint that can be put on and off by the patient. So this is fully locked. We fit it to my hand previously. I can slide it on, put my ring and small finger through. The band fits around the back side of the hand, and it's comfortable. It's not going anywhere. I cannot extend my ring and small finger MCP joints more than that, so it's functioning very effectively as an anti-claw splint. Comfortable, removable, washable, breathable, and that's the Hook Splint Max doing an anti-claw.